enter my patient's room, I'm just going to look for any flags or markers that I need to be aware of for any precautions for my patient. Once I do that, I'm going to enter the room. Knock, knock, knock. Come in. Hi, my name is Anna. I'm going to be your nurse today. I'm just going to do my hand hygiene really quick. Can you please tell me your name and date of birth?
Jacqueline Penzo, September 4th, 2000.
Okay, I'm going to shut the door and provide for privacy. And then I'm just going to explain today we'll be doing a head-to-toe assessment for you, just to get ready for your discharge, see if there's any underlying issues that we need to be aware of. Do you have any questions for me?
No.
Okay, now I'm going to raise the bed to a comfortable working height. Once I've done that, I can begin my assessment. So I'm just looking overall at my patient. I'm looking at her facial expression. She seems to be relaxed. She's in a comfortable position. She seems to be in a good mood. I just heard her speak. She seems to have good speech and she comprehends easily. I'm looking at her overall appearance. She seems to be in good hygiene. She seems to be well groomed and dressed appropriately. She also seems to be in a good weight for her height and age range, so she seems to have good nutritional status. After this, I'm just going to begin to palpate her skin. I'm looking for overall color and uniformity and consistency within the skin. I'm assessing for any lesions or rashes or tenderness. The color is consistent with her race and ethnicity. It's uniform. I'm also just testing, I'm feeling her skin. It's warm, it's smooth. I'm testing the turgor. There's no tenting. That would be a sign of dehydration. I'm also going to take this time to look for any wounds or dressings I need to be aware of. With this, I'm just using the Braden scale. I would look for any skin breakdown or pressure ulcer risk factors that I should be aware of. And once I do this, I'm just going to move on. I'm going to ask, did someone come in and take your vitals earlier?
Yes.
Okay, so I'm just going to check those out. If there was any abnormalities, I would retake them and check them and document them again. Are you in any pain today?
No.
So you would say on a scale from 0 to 10, what would your pain be?
0.
Okay, now I'm just going to begin my neurologic exam. So I'm looking at her facial expressions and I'm assessing her level of consciousness. So my patient seems to be awake and alert, oriented. Her eye movements are spontaneous. I'm also going to ask, do you know where you are?
Hospital.
Do you know what city you're in?
Tampa.
Do you know what date it is?
April 27th, 2020.
Okay. So my patient seems to be oriented. Now I'm just going to begin by looking at your face. I'm looking at the overall symmetry. Your nose is midline. Your palpebral fissures are equal and symmetric. I'm looking at her eyebrows and her eyelashes. There's even hair distribution and they are symmetrical. I'm looking at the sclera and I'm noticing that it's white. Her conjunctiva is pink. Her eyelids fall midline from her irises, showing that her eyes are symmetric. I'm just touching her lacrimal gland. There's no drainage and the orbital area has no edema. Now I'm just going to assess her pupillary response. So I'm looking for direct and consensual light on both eyes and it seems to be accommodating well. And now I'm just going to have you follow my pen light. Okay, very good job. I'm just going to have you sit up for me. Okay, now I'm just going to be palpating her ears, feeling for any lesions, masses. Is there any pain or tenderness when I do this?
No.
Okay, now I'm just going to whisper behind you 3 words. I'm going to have you repeat them.
9, 7, 8. 2, 4, 6.
Okay, very good job. Now you can lie back down. Now I'm just looking at her lips, I'm looking at her mouth. It seems to be symmetrical. Her lips are pink, she has no cracks, no lesions on her lips. I'm going to have you open your mouth. I'm assessing the buccal mucosa. It's pink and it's moist. And I'm looking at her tongue. It's also pink and moist with taste buds present. I'm going to have you stick out your tongue for me. And I'm noting that the uvula and the soft palate rise evenly. I'm going to have you lift up your tongue. And I see that it's pink underneath on the floor of your mouth. And I'm noticing there are vessels present, which is normal. And can you just stick out your tongue for me? And move it side to side. And say, ah, ah. Okay, so once I've done that, I'm now going to move on and have you sit up. You just move your head side to side for me. Okay, and can you push against my hand? And push against my hand. And shrug your shoulders. Okay, and push against my hands. Okay, very good. So now you can, I'm going to assess your neck now. With this, I am going to begin palpating her trachea. I'm displacing it to see any masses or any issues. I'm noting the cartilage rings, which are normal. Now I'm going to assess your thyroid, so I'm just going to have you take a sip of water and hold it in your mouth. And then I'm going to push to the side and feel it. And other side, please. Take another sip of water. Okay, very good job. Now I'm just going to assess her lymph nodes. So I'm going to be touching the pre-auricular, the post-auricular, behind the ear, the tonsillar, the submandibular, and the submental. I'm also looking at the posterior cervical chain, and the superior cervical chain, and the deep cervical chain. I'm also going to assess the supraclavicular chain. Okay, and you can lay back down. Now I'm just going to assess your extremities, so if you can raise your arms up for me, and then raise your arms up against resistance. Okay, very good. And one leg, and the other leg, and do it again. Okay, and then push against my hands. Very good job. Now I'm just going to be testing for sensation in your extremities, so close your eyes, and then I'm going to have you tell me if I'm touching your right, left leg, or arm.
Left arm, right leg, left leg, right arm.
Okay, very good job. So once we've done that, we can now move on to our respiratory assessment. So now I'm just looking at my patient and I'm noting if she has any oxygen devices assisting her with breathing. She does not, but if she was, I would check for her skin integrity, the patency of the device, the setting, if the FiO2 was from 80 to 100, anything like that, any skin breakdown. Once I've done that, I can now have her sit up. I'm going to just inspect her overall breathing. It seems to be even and unlabored. She seems to have no retraction, no distress. I'm looking at her AP diameter and it seems to be 1 to 2, which is good. Her anterior and her posterior are symmetric. And once I've done this, I'm just going to go in and auscultate her breathing. So I'm just going to actually, I have you like move. Sure. Okay. Take a nice deep breath for me and breathe out. Okay, do it again. again. And again. And again. 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 One more time. And one more. Okay. You just turn around to the front for me. Thank you. Okay. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay, once I've done that, I'm just going to have you take a nice deep breath and cough for me. Okay, is there any mucus or any secretions that you feel?
No.
No? Okay, if there was, I would note any color or the consistency and the amount that can be documented. Has anyone come in and talk about the incentive spirometer with
Yes.
you? Okay, so that's basically just a device that's going to help your lung muscles and your breathing as well, but you've already been educated on that. So we're just going to have you lie back down. Now I'm going to just assess and inspect her jugular veins. There seems to be no distension, which is good. I'm going to begin by auscultating the apex of her heart. Okay. Okay, lie back down for me. Thank you. Now I'm going to assess the apex and the radial pulse, and they are even and regular and clear. There's a pulse for every beat, which is good. And now I'm just going to auscultate the 5 regions of your heart. So I'm going to be looking at the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral point, which is also your apical pulse. So you can lie back down now.
And you forgot to do the other side.
Wait, it's still recording. Lay back down. Okay. Okay, and then I'm going to use my bell. Okay, if I had any trouble or any suspicion of a murmur, I would lay her on her left lateral side or sit her up to hear her pulses. Did not have any problem with that. So once I've done that, I'm just going to look for any pretibial edema. And you seem to be good. And I'm going to check for capillary refill. And on your toes. Good. Now I'm just going to assess your radial pulses and your posterior tibial pulses and your dorsalis pedis pulses. If I had any problems hearing this or feeling this, I would use the Doppler device, which would help me better hear those pulses. And now I'm just going to assess her IV site, look for any infection, infiltration. It seems to be intact and working well. So now that I've done that, I'm going to move on to your abdomen. So the first thing I'm noting is the contour of her abdomen. It seems to be flat, smooth, no masses that are visible to the eye. Once I've done that, I'm going to go in and auscultate her bowel sounds at each quadrant for 10 to 15 seconds. and now I'm just going to palpate her stomach. Do you have any pain in your stomach that I should be aware of?
No.
Okay, so I'm just going in a circular motion. I'm looking for any masses, any tenderness that I need to be aware of. Seems to be good. Now that I've done this, I would assess now for an NG2, any drainage that I need to be aware of. And then I'm going to go on and I'm going to ask you when the last time you had a bowel movement was.
About an hour ago.
Okay, can you tell me about the color, the consistency, the amount?
It was brown and normal.
Okay. And how is your diet? Do you feel that it works well for you?
Yes.
Okay, and if there was an issue with her diet, I would speak to her about changing it, advancing it, anything like that, so she's more comfortable. I'm also going to ask you about your voiding habits. So is there any pain or burning when you pee?
No.
And what is the color of your urine?
I like yellow.
Okay, is there any odor?
No.
And I would note any quantity issues. And then at this time I would also note if there was a catheter. If there was, I would inspect the urine myself, looking for color, consistency, odor, quality, or quantity. I would also use a bladder scanner if she complained of any retention, any suspected retention. If she was having the feeling that she needed to urinate but she could not, is when I would use it. So now we're just going to move on to a little activity. I'm going to lower her bed and put the brakes on. I'm going to remove any STD devices that she has on. And then I'm going to have you sit up. I'm going to use the Morse scale, and I'm just going to ask you if you have any dizziness or lightheadedness.
No.
Okay, and do you have any devices needed to help you ambulate?
No.
And do you have any problems with walking where you are? Okay, this is just to assess if she is a fall risk and if she needs any certain type of assistance or device to walk. So now I'm just going to assist her and direct her, and I'm going to have you stand up and walk over to that chair and sit in it. Then I also have you walk about 10 steps for me. I'm noting any problems walking, any issues turning, and sit back down. Her gait seems to be quick-paced and steady, which is normal for someone of her age. Now I would just replace any STD devices that she has. You can lay back down. I would raise the side rail for her safety. At this point, I would turn the call light, or make sure she's aware of the call light, any alarms necessary, have the side rails up. The bed is in a comfortable position for her. I would state that for your plan of care, we're just planning for discharge today, and I'm going to thank my patient for being cooperative, going to do my hand hygiene, and I'm going to go and document any care that I've done, anything I need to note, and